Today we are going to present our program development for the Greenway Rehabilitation Center. The Greenway Rehabilitation Center has 42 children that are all affected by cerebral palsy. Their mission is to send children back into society having improved and grown to their fullest potential. They do recreational activities with the children to work on their cognitive development. They help them with their systemic health. They do try to help them with their oral health the best they can, but we're going to try to develop a program that will ensure that the children have significantly improved oral health. So cerebral palsy is a unique brain disorder that is characterized by impaired movement, stiffness, muscle weakness, poor coordination, and other disabilities. 20% of children with cerebral palsy are seriously disabled, 25 to 30% have seizure disorders, and 40 to 50 have an intellectual disability. Cerebral palsy can affect their oral health significantly. There are a few oral manifestations, which include tongue thrusting, clenching, bruxism, mouth breathing, medication-induced gingival hyperplasia, higher caries indice, and higher gingivitis indice. So there is a dentist that visits once a month, and so we are able to get some background data on the children in the facility. There is one dental operatory on site, and the children are given a thorough head and neck exam when they enter the home. Dental charting and x-rays are available, and oral conditions such as tongue thrusting, clenching, bruxism, and mouth breathing are noted as well. All children have regularly scheduled dental checkups, and they do have DMFT scores, which is 6.7, and their OHIS score is an average of 2.5. The children are very fearful of receiving dental treatment as well. So we met with the house mothers and the dentist to assess their needs and come to a conclusion. Brushing is performed haphazardly by children. The house mothers are not comfortable providing assistance to the children with their oral health care. They want to, they just don't have as much knowledge as they would like to. Toothbrushes are difficult for the children to handle. The children are also rewarded for good behavior with caries producing food. So we prioritize them in a chronological order of what should be taken care of first. And the first one is reduce fear of dental treatment. And the second is more thorough oral hygiene. And then we would like to make the house mothers feel more comfortable providing oral hygiene assistance to the children. Toothbrushes that are easier for the children to handle, we would like to provide those. And an alternative reward for good behavior. So there are many resources that we are able to use inside the center and within the community. The first one is the willingness of house mothers to help children, and the fact that the local dentist works there once per month. Dental charting, x-rays, oral conditions are available, and children have regularly scheduled dental visits. We have the DMFT scores and the OHIS scores. There are mobile dental units provided by Medicaid. Donations of mouth rinses and toothpaste from local dental offices. We have a local sporting goods store that is going to donate some tennis balls to put on the children's toothbrushes. Pledges from 7 local dental offices that are going to provide 6 Oral-B toothbrushes each. A dental hygiene instructor that teaches nutrition is going to come and talk to the house mothers and teach them about foods and how nutrition can relate to your oral health. We also have a pledge from a local prosthodontist to fabricate and place all needed mouth guards and tongue thrusting devices that accept Medicaid. We have volunteer dental hygiene and dental assisting students from the local community college. They will volunteer for exchange for their community service hours. So there are several constraints that we have identified as well. Tongue thrusting, clenching, bruxism, and mouth breathing. Children are intimidated and fearful of receiving treatment. Brushing is performed haphazardly House mothers are not comfortable assisting children due to lack of oral hygiene education and proper intervention techniques. Toothbrushes are difficult to hold. The children are rewarded with caries-producing foods, medication, induced gingival hyperplasia, excessive salivation, uncontrolled head and mandibular movements, and uncontrolled bruxism or seizures. So our mission is to allow the children to reach their fullest potential of oral hygiene by enhancing their oral health through collaboration of staff and community volunteers. So we have 3 goals, and the first one is to improve the OHI scores of the children by implementing protocols to reduce the children's dental fear and oral hygiene interventions. We're going to decrease their dental fears to at least a 3 on the dental fear scale that we have provided within 1 month of program implementation by field trips to a local community college, Smile Day, and associating trips to their dental operatory as rewards. So we would also like to achieve and maintain an OHI score of a 1 or lower by replication of proper use of Oral-B electric toothbrushes and oral hygiene interventions performed by the children and house mothers at the center within 5 weeks of program implementation. So the first objective, how we're going to accomplish it is we want to allow the children to get familiar with the dental equipment and how the dental equipment will proceed before their scheduled dental appointments. We will use the trips to the dental operatory as a reward, so the children will associate the dental clinic with being rewarded. And the dental hygiene students will host a Smile Day for the Greenway Rehabilitation Center. This is our perceived fear scale that we will rate the children by once we perform it. I think we're going to do it twice on our calendar that we provided. The first, number 1 and 2, is just slight discomfort. 3 and 4 is butterflies in the stomach and accelerated heartbeat, which is where we would like the children to at least be at a 3. And we think with the implementations that we have that is very achievable.